Welcome back, dear students, for today's session. In this session, let us go with neat solutions of the chapter Reproductive Health. The first question we have here is Family Planning Program was initiated in. Dear students, 4 options have been given, out of which we need to identify when was this family planning program was initiated. See, dear students, in the year 1951 in India at the national level, alright, the family planning program was initiated. It was at the national level, alright. What was the goal? The goal was very important here because it aimed at attaining total reproductive health, alright. So attaining total reproductive health, that was the goal of the family planning, my dear friends, and also see, family planning as a social goal as well, it was included, right? So here, especially as we all know that our India is a very populous country and family planning program was necessary, and because of the same it was introduced in the year 1951. So we have to go for the option D, that is our right answer. The next question we have, dear students, reproductive health in society can be improved by, 4 options have been given here. Introduction of sex education in schools, see, how the reproductive health can be improved is the aspect we need to consider here, the first aspect which is given here is what? Introduction of sex education in schools. Yes, indeed, introduction of sex education, yes, it should be very much encouraged, dear students, in the high school and also in the colleges, it will provide the right information, to the young, very much right information to the young, so as to discourage children from believing in also myths and misconceptions, here there are so many myths and misconceptions, so basically I can say the people believe in many aspects of reproductive health which does not exist, or rather I can say that there are so many improvements which are needed to have 100% reproductive health, but still there are myths and conceptions which needs to be discouraged among the children. So see this, let me tell you that this fifth option here, we cannot include here, it is not, reproductive health cannot be improved by encouraging myths and beliefs. It is absolutely, we cannot go with the option 5. Anyway, next, second option we have increased medical assistance. Yes, dear students, to address the problems of reproductive health and also the reproductive health, say for example, especially of women, pregnant women, menstruating women, the young teenage boys and girls, so yes, indeed, medical assistance should be provided in each and every aspect of reproductive health, so if it is increased, that's well and good that reproductive healthy society can be possible. Then third option, awareness about contraception and sexually transmitted diseases. STDs here refers to sexually transmitted diseases, my dear friends, so yes, indeed, very much awareness is needed on STDs as well as on the contraception. Contraception means how to avoid being pregnant, what are the strategies, and what are the outcomes, what are the advantages of the same, what are the disadvantages of other different types of contraception, everything will be known. Awareness of the same is required for becoming the reproductive healthy society. So option 3 is also correct, my dear friends. 1, 2, 3 is as well correct. So fourth option we have equal opportunities to male and female child should be given. Yes, indeed, so this is very much required because here it eliminates inequality among the men and women, and definitely it will provide the right platform for both male and the female child to expose themselves to the social environment, and also work for the betterment of their own life as well as their family. All right, so that will eliminate the gender equality which is present. So anyway, my dear friends, option 1, 2, 3 and 4 is absolutely correct, and option 5th, as I said, you myths and misconceptions should never be encouraged, especially among the the children. So 1, 2, 3 and 4 are correct. So going by that, we have to go for option C. That will be our right answer. Then dear students, let me move to the next question. We have here amniocentesis, is a technique used to, see, let me tell you, dear friend, that amniocentesis is a disorder detection test. It's a diagnostic test, for diagnosing, especially many important disorders pertaining to genetic, or if for example fetal disorders, we can easily know. Friends, so we can say rather it's a diagnostic tool for detecting disorders based on chromosomal pattern. That would be more appropriate. Here, based on chromosomal pattern, we can know many disorders, especially of the fetus. But dear friends, let me tell you, this amniocentesis is misutilized for determining the sex of an individual. That should not be done. Sex of the individual, should never be performed. It is especially a crime in our country. So because whether it is a male or whether it is a female, both have equality in the society, and never any of them should be in fact discriminated based on their sex. So sex of the individual, to identify that, amniocentesis is misutilized. My friends, and also let me tell you, my friends, that further it leads to, after knowing the sex of the fetus, it leads to killing the normal female fetuses. That's also a huge crime, but it is done. Therefore, I can say that it is legally banned to avoid female feticide. So among the given options, you have to go for option C, that amniocentesis is a technique used to determine hereditary genetic abnormality in the embryo. And also, what I can say, sex can be determined, but remember that it is a crime. So go for option C. Next question we have, which of the following cannot be detected in a developing fetus by amniocentesis? Cannot be detected in developing fetus through a test called amniocentesis. Already I have told you, amniocentesis is a disorder detection test based on chromosomal pattern. Children, now let me tell you, see, first of all, so I have told you chromosomal pattern. So genetic or hereditary disorders can be easily identified through the amniocentesis. See, there are here 3 hereditary disorders which have been mentioned. One is the Down syndrome, then cystic fibrosis and color blindness, which can be detected. It can be easily detected by amniocentesis. But jaundice cannot be detected. See, jaundice is a infectious disorder, children. See, it's an infectious disorder. Or it's a digestive disorder, dear friends. So let me tell you what happens. Already jaundice, yellow skin. There will be, in case of jaundice, yellow skin. Why this yellow skin is caused, or yellowing of nails, yellowing of eye white? All this happens because of buildup of this pigment called bilirubin. Especially in the blood. Because of this, the jaundice is caused, and jaundice is very much normal in the children, and it can definitely clears on its own. No doubt about it. Most of the cases it happens as such anyway. But Down syndrome, which is also called as 21st trisomy, where one extra somatic chromosome is present, due to which the somatic characters are affected. So it can be detected by amniocentesis. Cystic fibrosis, dear friends, it's a inherited life-threatening disorder. And here, my friends, let me tell you that generally it damages the lungs and digestive system. Lungs and the digestive system is damaged by a disease, hereditary disorder called as cystic fibrosis. What happens here? it affects the cells that produce mucus, sweat and digestive juices. So that is what is cystic fibrosis. And further we have color blindness. Alright, so everyone is well familiar with color blindness. So it is also a hereditary disease. So what happens with respect to color blindness is that the person has inability to distinguish between generally the shades of red and green, dear friends. Alright, that's what we call it to as the cystic fibrosis. Alright, so anyway, so going by the same, alright, the test which cannot be detected by amniocentesis is the infectious disease. Here we call it to as the jaundice. It can be a symptom in hepatitis or it can be a disease. Alright, so please go for option 1. Next, dear friends, next question we have here: in which of the following weeks of pregnancy the CVS is done? Alright, first of all, we need to understand that what we mean by CVS. CVS in full form is referred to as chorionic villus sampling. Alright, see, chorionic villus, alright, sampling. It is what we can say the abbreviation of the CVS. And let me tell you, dear friends, that it is a technique for identifying the fetal disorders, especially most importantly. Alright, one of the important technique again for knowing the fetal disorders. Alright, here, dear friends, these fetal disorders can generally be known only during the early pregnancy. What happens here, see, chorionic villus sample, in this test what the doctor does is he inserts a flexible tube, alright, which is very thin and which is very narrow through the mother's vagina, alright, and the cervix into the uterus. Alright, see, now if you consider the female reproductive system, alright, let us say from the vagina to the cervix and then to the uterus, alright, it is inserted the flexible tube. Alright, after the introduction, alright, the doctor derives the chorionic villi from the placenta. Alright, the chorionic villi is part of the placenta. So this chorionic villi is taken out, alright, through that flexible narrow tube by a doctor. Alright, and later, dear friends, what happens, the cells of this chorionic villi are in fact examined by the doctor for various disorders. Alright, children, so generally, alright, it is done early, as I said, in the early pregnancy, especially between 8th to 10th week, my dear friends. Alright, and alright, abortion will be, alright, because of this, it is done in the 8th to 10th week of pregnancy, when abortion is safe for the woman. If any disorder is there, any defect is there, scientific defect, the doctor says for some rectification or for the medical termination. Alright, only in some scientific cases, if there is danger to the baby or danger to the mother. Alright, that is why it is considered to be done the CVS test, that is chorionic villus sampling test, in the 8th to 10th week. So the right answer here is option 2. Please go for it. Next question we have: which of the following are the reasons for population explosion? We need to identify, alright, out of the 5 statements given here. Alright, five reasons rather. So here, dear friends, population explosion, first of all, let me tell you that it means to say there is rapid increase in population over a period of time, short period of time. Alright, as we can see, our especially India is a very populous country, and there are of course many reasons for the same, but here we need to identify some of the reasons related to the reproductive aspects. So here the first option given here is increased health facilities. Alright, when there is good health facilities, the life of the person will be, or an individual will be prolonged. Alright, so the death will be, rather I can say death rate will decrease here. Alright, so of course, option 1 is the reason for population explosion. But second, let us understand, we have MMR. See here, MMR, dear students, refers to maternal mortality rate. Alright, or maternal mortality rate, or we can also refer this to as the maternal death. Alright, maternal death also we can say. So generally what it is, you know, it is defined as the death of a woman while being pregnant. All right, when the woman is pregnant, or within 42 days of termination of pregnancy. If the woman has terminated the pregnancy, all right, within if 42 days, if that woman dies, then that is also MMR, maternal mortality rate. All right, so it does not contribute for population explosion. Then third option, rapid increase in IMR. So IMR, infant mortality rate, that means to say number of deaths per 1000 live births, especially in children under the age of 1, infant mortality rate. It does not contribute for the population explosion. Then rapid decrease in IMR. All right, decrease, if there is decrease in maternal mortality rate, it will contribute for population explosion, because all right, you know, the population is increased here. All right, so that is the simple meaning. But anyway, my dear friends, next we have decrease in number of people reaching reproductive age. All right, here see, we need to understand, if there is decrease in the people reaching the reproductive age, definitely it is not the factor we have to consider for population explosion. All right, it should increase. All right, if it increases, then it's a reason for population explosion. If it decreases, it is not a reason for population explosion. Anyway, see, only option 1 and 5 are related with population, 1 and 4 are related with population explosion. So you have to go for option 1 itself. That is your right answer. Then dear friends, next question we have, which of the following pairs contributes to an increase in population? All right, so to increase the population, what are the factors here we need to identify? See, first option is natality and immigration. First of all, let me tell you what do you mean by natality. All right, see, it is the proportion of births, all right, to the total population in a given time. In a given time, how many births occurred, that is what we call it to add as the natality. All right, and then immigration. Here, dear friends, let me tell you that immigration is the movement of individuals. All right, movement of individuals into, all right, movement of individuals into an area from some other place. If the people come to a particular area, all right, so that is causing what, increase in population. So dear student, first option itself is correct. See, mortality means here already we know, all right, it is, all right, the death of the people in a given place at a given time, right? So that cannot be considered here. That does not increase the population, decreases the population. Emigration means individuals who left an area in a particular given period of time, all right, from a particular area. So that is also not the factor. Both are decreasing the population, they are not increasing. All right, then natality and emigration have been given. Third option is what, dear friends? Natality and emigration. Of course, natality contributes, but emigration does not contribute. Then mortality and immigration. Mortality does not contribute, immigration contributes. But what we need, dear friends, here, both should match. So natality also contributes for population increase as well as the immigration. So you have to go for option 1. That will be your right answer. Then dear friends, we have the next question. The best way to decrease population of a country is, all right, to educate people, to have better houses, all right, to kill people on a large scale, to practice and implement family planning. So 4 options have been given. So let me tell you, it's a direct question, all right, and we need to know that practicing and implementing as well the family planning, you know, both here 2 aspects need to be remembered. Not only practicing, right friends, along with this, even implementing the family planning program, all right, is very necessary. All right, children. So for, all right, very necessary for decreasing the population of a country. All right, and dear friends, in the family planning, of course, as we all know, how the, you know, for example, let me tell you, adopting the various methods of contraception, how it has to be done, all right, is one of the important aspects which can be included under family planning, through which population can be controlled, dear friends. All right, so anyway, option D is the right answer here. All right, next dear friends, next question we have, which of the following is not a characteristic of an ideal contraceptive? So here again, contraceptive, all right, is a, what we can say, contraceptive is an important all right, contraception is an important method of avoiding pregnancy. All right, contraceptive is it can be of various types. It can be oral contraceptive, or it can be intrauterine device, or it can be vault, it can be diaphragm, or in many other forms, implants, or many different contraceptives are available to avoid the pregnancy. It can be an instrument, or it can be progesterone estrogen complex as such. Anyway, dear friends, now let me tell you which is not a characteristic of all right, not a characteristic of ideal contraceptive. Ideal means it should be, what I can say, very easy and very comfortable, as well as effective and efficient. All right, that can be said as what? Ideal contraceptive. Anyway, dear friends, an ideal contraceptive should be user friendly. All right, and ideal contraceptive should also be easily available. All right, where in the all the medical stores and in the public places it should be available. All right, and also it should have least side effects. Side effects should be very minimum. All right, so this is what we call ideal contraceptive, dear friends. All right, but it should not be irreversible. Are you following my point, children? See, it should be reversible with no or very very least side effects. All right, but it should not be irreversible, dear friends. So option B is the correct one. So we have to go for second option. Next question we have: on which of the following facts does the method of periodic abstinence is based? See, first of all, let me tell you that periodic abstinence is a method of natural contraception. All right, so what is the fact of this? We need to identify from the given four options. All right, see here, first of all, let me tell you, A, they have given as what? Ovulation occurs on about the 14th day of menstruation. All right, I can definitely tell you that it is the fact which we need to consider when we are talking about periodic abstinence, because periodic abstinence is a method of natural contraception in which couples avoid intercourse from 10th to, all right, especially from 10th to 17th day of menstrual cycle. All right, 10th to 17th day of menstrual cycle, the couples avoid the sexual intercourse. All right, and this is, of course, see, now considering this, my dear friends, let me tell you, the first option, ovulation occurs on the 14th day of menstruation. So this is a fact which we need to consider for periodic abstinence, because 10th to 17th day we are considering here as the important time intervals where the person can get pregnant. All right, the individual, all right, the woman can get pregnant. Anyway, B, we have ovum remains alive for about 1 to 2 days. All right, see here, ovum of course remains alive for 1 to 2 days. All right, and let me tell you that, and sperm also survives for around 3 days. All right, sperm also survives for 3 days. That is the fact. Let us say, for example, if ovulation has occurred on the 14th day, probably if the egg, if it survives for 2 days, let us say until the 16th day, or if ovulation has probably occurred on 15th day, till 17th day it can survive. That's where there is extended period. Or if before 14th day, 13th day or 12th day ovulation may occur in some cases. That's where 10th to 17th day is very much danger. All right, so that's we need to consider those aspects here. All right, children, so the first option is the fact which is related to periodic abstinence, and also second as well as the third. All right, friends, so the we can say that as all of these option is given, so you can go for option 4. That will be your right answer. All right, then dear friends, next question we have: which of the following is a non-medicated intrauterine device? All right, non-medicated intrauterine device we need to identify here. See here, copper T as well as copper 7. All right, they are both copper releasing iuds. All right, copper releasing iuds, dear friends. Okay, so they prevent, both of them prevent, of course, the conception, And there is one more thing called LNG20. It is a, all right, hormone releasing IUD. All right, friends, it is LNG20 is what? Hormone releasing IUD. All right, copper T and copper 7 are copper releasing IUDs, and lipase loop, all right, is medicated IUD. See, please understand, we need to identify here non-medicated. So the answer which you have to go for, all right, my dear friends, all right, so here is B, all right, lipase loop. It is not the non-medicated intrauterine device. All right, so we can say copper T, all right, copper 7 as well as LNG20 are medicated IUDs, whereas lipase loop is not the one. All right, all this anyway, all right, help in avoiding the pregnancy. Next question we have, IUDs prevent pregnancy by, four options have been given: inhibiting physiological and morphological uterine changes required for implantation. Yes, indeed, all right, uterine changes in both, physiologically as well as morphologically are caused by the IUDs. Option 1 is correct. All right, and they increase the phagocytosis of the spermatozoa within the uterus. That's also correct, my dear friends. IUDs also, increase the phagocytosis of the spermatozoa, suppressing motility of sperms, all right, and their fertilizing capacity. That's also an important property of IUDs. All right, so all of this is the right answer. Okay, let me break up and tell you that the IUDs can be classified into copper releasing IUDs and the hormonal releasing IUDs. First of all, let me talk about copper releasing IUDs. All right, say for example we have copper T, copper 7, multi-load. All right, all these are what? Copper releasing IUDs. See, remember that these copper releasing IUDs increases the phagocytosis, all right, of the sperms within the uterus. That is performed by copper releasing IUDs, remember more specifically. And also they act on the fertilizing capacity of sperms. All right, they affect the sperm motility and as well as the, all right, the fertilizing capacity of the sperms. That is the function of copper releasing IUDs, my dear friends. And when you are talking about the hormone releasing IUDs, all right, let me tell you that the most important hormone releasing IUDs, for example, let me tell you progest assert, or even you can give an example as LNG20. All right, these two, all right, especially the hormone releasing IUDs, what, for example, let me say, so these hormone releasing IUDs make the uterus unsuitable for implantation. So the first option is a, all right, and also cervix hostile for sperm. So the first option is related with hormone releasing IUDs, and the second B and C are related with copper releasing IUDs more specifically. But anyway, as generally it is IUDs prevent pregnancy, they have asked. All right, so all of these are the correct ones. So you have to go for option number 4. That will be your right answer, my dear friends. Then next question we have here is, the birth control device used by women is, dear friends, here 4 options have been given: diaphragm, vault, copper T, and all of these. All right, let me tell you, diaphragm and vault. See, this diaphragm and vault, these two are, all right, the barrier methods used by women. All right, there are different methods of contraception. It can be oral contraception or barrier contraception. All right, so all these are artificial or even naturally also, like for example periodic abstinence, before we discuss lactational amenorrhea. All right, all these are natural, but barrier comes, many different types. All right, under women, generally diaphragm and vault among the given options are the barrier types of contraception which are available for women or used by women. All right, my dear friends, so copper T, which is given, it's an IUD. All right, this is an IUD, intrauterine device, all right, which is used by the woman. All right, again it is also used by the woman. So anyway, my dear friend, the right answer which you have to go for is what? All of this. All right, the birth control device used by women is all of this. Diaphragm and vault are the barrier methods used by women. IUD, copper T is a IUD used by women. But anyway, all are birth control devices. So you have to go for option D. Next question we have here is, the most important component of, all right, the oral contraceptive pills is. All right. So, dear friends, four options have been given: progesterone, estrogen, growth hormone, thyroxine, and luteinizing hormone. Here, let me tell you that growth hormone, thyroxine, and luteinizing hormone does not have any role in contraception. First of all, anyway, progesterone and estrogen are important components of oral contraceptives. See, this progesterone, estrogen, what it does is it affects the follicular development. Alright, see, in the ovary, primary, secondary, tertiary follicle, Graafian follicle are present, right? In the Graafian follicle, the matured egg is present before the formation of egg itself. Alright, the follicles may be damaged, degraded. Alright, when progesterone, estrogen, which is present in the oral contraceptive acts. And further, when there is follicular development is affected, definitely it does not lead to the formation of ovum as well. So that anyway, this is what. But anyway, remember that progesterone and estrogen in various concentrations, they are given in oral contraceptive pills. So the right answer is option A. Next question we have, what is true about saheli? Alright. See, first of all, let me tell you, my dear friends, that saheli is a oral contraceptive pill. Alright, or oral pill we can refer it to as. Alright, children. See, let me tell you that it is taken, this oral contraceptive pill, to avoid the conception. Alright, it has to be taken, alright, once in a week. At least it has to be taken once in a week, my dear friends. Alright, that is I can say that after an initial intake of twice a week dose for 3 months. Initial for 3 months we have to take, alright, 2 pills. Alright, after that, alright, once a week, alright, we can go for. Anyway, so it's what I can say, it has very high contraceptive value and very effectively utilized by throughout various across places as well as commonly available. Anyway, because it has very less or very little side effects, my dear friends. That's a important advantage. It's a very, what I can say, valuable contraceptive, oral contraceptive. Alright, it was developed by Central Drug Research Institute, Lucknow. Okay, so these are the common aspects you need to remember. So let me now say what are the options available here. So developed at CDRI, Lucknow. As I said, yes, so it is developed by Central Drug Research Institute in the Lucknow. So that's correct. And secondly, we have here contains steroidal preparation. All right, second option has been mentioned here as it contains steroidal preparation. So it does not have any steroidal preparation as such. All right, so option 2 we cannot consider. Once a week pill, yes, we can consider this. All right, but initially 3 months, as I said you, we have two, saheli have to be taken. Later 2. All right, later 1 in a week. Then, dear friends, many side effects. No, definitely it does not have much of side effects. Yes, it has high contraceptive value and it has very few side effects. All right, children. It has high contraceptive value. It is not low contraceptive value. Now you can choose from the options which I have given here. See, ticked options are correct. 1, 3 and 5, 6. 1, 3, 5, 6 you have to go for. So option B is the correct one, my dear friends. Next question we have, select the correct statement regarding the subcutaneous implantation of synthetic progesterone. Dear students, whenever subcutaneous implantation it is said, that means to say beneath the skin. Alright, when the progesterone, alright, synthetic progesterone is implanted, alright, so what actually happens? Alright, correct statement we need to identify among the same. See, this subcutaneous implantation of synthetic progesterone is a contraception technique. It's correct option. Alright, dear friends. And B, it blocks ovulation and prevents sperm transport. Yes, alright, as it has progesterone, the important role of progesterone here is to block the ovulation right during the menstrual cycle and also to prevent the sperm transportation. Alright, so that is also correct. Then Six matchstick size capsules containing the progestogen steroid are alright inserted under the skin. Yes, it is subcutaneous, right? So progesterone, yes, 6 capsules only. Generally it will be matchstick sized. Yes, it is also correct. Alright, where it is injected beneath the skin, alright, of the inner arm, just above the elbow it is inserted. All three are correct, my dear friend. The right answer you have to go for here is option for all of these. Alright, and see the capsules which contain, alright, the synthetic progesterone, alright, will alright, release the progesterone for approximately 5 years, my dear friend. They release continuously, keep releasing, alright, time in and time out for around 5 years, my dear students. Alright, as I said you, most important, it blocks ovulation. Alright, why it blocks ovulation? It blocks ovulation by, alright, inhibiting the release of follicle stimulating hormone, alright, as well as LH from the pituitary gland. It, alright, so it inhibits FSH and LH, alright. So this is how, alright, it's very important to understand this, my dear friends. So all of this option is the correct for this question. Next question we have, which of the following birth control, alright, measures can be considered as safest? Alright, 4 options have been given here: the rhythm period, the use of physical barriers, contraceptive pills, and the sterilization technique. See, the rhythm period is a natural contraception method. Alright, the physical barriers is a artificial contraception. Alright, where we use physical barriers, condoms, diaphragms, valves. Alright, all this. And contraceptive pills, alright, are also being used, for example saheli. Alright, then sterilization techniques. Yes, sterilization techniques means, see, vasectomy and tubectomy, my dear friends. Vasectomy is a sterilization technique where vas difference is cut and tied in with respect to males, and tubectomy, alright, is a permanent alright contraception method which is performed in females, my dear friends. Alright, where the fallopian tubes are cut and tied. Alright, the permanent methods, alright, and the safest here, the meaning is what? They should not cause, alright, the pregnancy at all. So going by that, we can say the sterilization techniques are the one. So go for option 4. 18th question we have, which of the following represents the correct match of a sexually transmitted infection with its pathogen? So here, dear friends, we need to match the STD with the causative agent of the same. The first option given here is syphilis. Alright, here syphilis is caused by actually treponema pallidum. That's absolutely correct. So it's a sexually transmitted disease. Gonorrhea is also sexually transmitted disease which is not caused by entamoeba histolytica. Rather, it is caused by Neisseria gonorrhoeae. Alright, so remember that. Alright, then so third option, urethritis. See, what is urethritis here? Urethritis refers to the swelling and, alright, irritation, or rather we can say, alright, the inflammation of the urethra. Alright, urethra is affected, dear friends, here. Alright, so that is what we call it as urethritis, which can be caused either by the bacteria or the virus. Okay, so let me say the both bacteria like which causes gonorrhea, like gonococcus or chlamydia trachomatis. Say the gonococcus, alright, or for that matter I can also say trachomatis. Alright, both these bacteria can cause the inflammation of the urethra, what we call it as urethritis, but not the bacillus anthracis as been mentioned here in the option 3. Then option 4, we have soft sore. See, soft sore can also be referred to as soft cancer. Alright, so remember that, dear friends. Alright, and dear friends, it is the ulcer. Alright, see, the soft sore, alright, it is the ulcer which is of, we can say, ulcer of genital region, my dear friends. Alright, it is the ulcer of genital region, especially caused by one of the bacteria called Haemophilus alright, Ducreyi, alright, Ducreyi. So this is the bacteria which causes this soft sore or ulcer of genital region. Alright, my dear friends, so the right answer here is what? Syphilis, which is caused by Treponema pallidum. So please go for option A, that is our right answer. Next we have the sexually transmitted infection that can affect both male as well as female genitals and may also damage the eyes of babies born of infected mothers is, alright. See, this generally happens with respect to gonorrhea, my dear friends. See, gonorrhea affects the eyes, alright. Infected mothers can cause, alright, the infection to the pass on the infection to their babies, alright. So anyway, my dear friends, let me tell you here. See, it will cause eye pain, alright. To go with that, sensitivity to light can also be seen with respect to gonorrhea, alright. And also pus like discharge, alright, pus like discharge can also be seen here, alright. So anyway, so these are some of the symptoms associated with the gonorrhea affecting eyes, alright. This pus like discharge can be seen from one or both the eyes, alright. Note that point as well. Rather, dear friends, I can say gonorrhea is what it causes, rather why it damages first of all the eyes of babies. In severe cases, dear friends, alright, let me tell you that it can cause the ulceration of cornea, alright. And further, if I want to tell you that, alright, even the globe of the eye it can affect and also can cause permanent blindness, alright. It can be such severe, my dear friends, in severe cases, in chronic conditions. So anyway, so here just we need to know which of the sexually transmitted diseases other than affecting the male and female genitals can affect also the babies of infected mothers. So that is gonorrhea. Dear friends, now let us move on to the next question we have here. Which of the following is correct regarding, alright, HIV, hepatitis B and gonorrhea, alright, as well as trichomoniasis. Dear friends, let me tell you that here trichomoniasis is a STD whereas others are not. No, see, other than trichomoniasis, even see among the given options we need to consider gonorrhea is also sexually transmitted disease, HIV is also sexually transmitted disease, hepatitis B can also be transmitted through, alright, sexual intercourse, alright, and as also through blood. Anyway, my dear friends, now first option is wrong, alright. We have to correct the correct statement from here. Gonorrhea is a viral disease whereas others are bacterial. See, dear friends, gonorrhea first of all itself is a bacterial disease caused by Neisseria gonorrhoeae, alright. Gonorrhea is caused by Neisseria, alright, gonorrhoeae, alright. So remember that, my dear friends, alright. And it is a Neisseria gonorrhoeae is a bacteria, alright. It is not a virus, it's a bacteria, and we cannot go for option 2 as well, alright. See, others are, of course, no. Trichomoniasis is also a bacterial disease, alright. So given option 2 is wrong. Then HIV is a pathogen whereas others are diseases. Yes, see, trichomoniasis is a STD, gonorrhea is also what I can say is a STD, but HIV is a pathogen, alright, my friends. So the given statement C is correct. Even including hepatitis is also a disease, alright, hepatitis B, alright. So hepatitis B they are saying as what, eradicated completely. Dear friends, let me tell you that it is viral disease which is not yet eradicated completely. For the same we also go for vaccination, right? So anyway, the given answer is option C. Please go for it. Next question we have, which one of the following groups include sexually transmitted infections caused by bacteria only? Only caused by bacteria we need to include. See, syphilis is a bacterial sexually transmitted disease caused by Treponema pallidum. Gonorrhea is also a bacterial STD caused by Neisseria gonorrhoeae. Chancroid is a sexually transmitted disease, alright, caused by one of the bacteria called, alright, Haemophilus, alright, Haemophilus ducreyi, alright. So anyway, so this is also important to note down, alright, and this is also bacteria. So option 1 is correct. Let us go for option 2. Syphilis is also, as I said you, it's a bacterial STD. Chlamydiasis is also bacterial STD caused by, alright, chlamydia trachomatis, alright, chlamydia trachomatis, alright, it's also a bacterial disease, as well as chancroid is also a bacterial STD. All again, second option is also correct, my dear friends. Okay, let us also understand the third. C. Syphilis, gonorrhea and scabies. See, syphilis and gonorrhea are caused by bacteria but not scabies. Scabies is caused by arthropods, my dear friends. Alright, it's a sexually transmitted disease. Syphilis, scabies and pedicoccal. See, sexually transmitted infections caused by arthropods also includes pediculosis. Alright. So here, my dear friends, among the given following, both A and B can be correct here. Alright. Then, dear friends, we have next question. Confirmatory test for sexually transmitted infection. STI stands for sexually transmitted infections is. See, ELISA is a, alright, and the full form is enzyme linked immunosorbent assay. It's an antigen antibody related diagnostic test. Alright, it can be used for confirming the sexually transmitted diseases, definitely. Polymerase chain reaction through amplification of DNA also we can diagnose STI early. Then DNA hybridization, that means to say here generally what, it's a molecular biology technique, alright. So similarity between DNA sequences can be known through DNA hybridization. So all three can be used to understand and diagnose very clearly, confirmly the sexually transmitted infection. So we can go for option 4. All of these are confirmatory tests for sexually transmitted infections. Then, dear friends, next question we have here is, see, hepatitis B is transmitted through blood transfusion, intimate physical contact, sexual contact, and all of this. First of all, let me divide and tell you that hepatitis are of different types. See, hepatitis A, hepatitis D, hepatitis E, and hepatitis G. All these are caused due to, one is poor hygiene, alright, followed by, alright, contaminated water and food. Alright, my friends, generally it is spread through fecal and oral routes. And dear friends, next we have hepatitis B and hepatitis, alright, C. This hepatitis B and C, alright, can spread through, alright, generally it is called as serum hepatitis and spreads through sexual intercourse, alright. So remember that, my dear friends. And also it can be, it can spread through the saliva, sweat, tear, breast milk, and so on. Anyway, my dear friends, among the given options, hepatitis B can spread through blood transfusion, intimate physical contact, as well as the sexual contact. So option D is the correct one. Which method can be used for women that cannot produce ovum but can provide suitable environment? Alright. See, anyway, so the ovum, when it is not produced, alright, when the female gamete is not produced, alright, so what has to be done is that, but suitable environment she provides. So others, the, what we can say, the gift can be followed here, gamete intra fallopian into the fallopian tube, alright. The both gametes can be in fact transferred, so that chances are there, the suitable environment is existing, so the pregnancy can happen. But here both the gametes should be introduced. That's very essential. Anyway, dear friends, here, alright, and see, IUD, intrauterine device, it's a contraceptive method. It cannot be the option here. IUI, alright, intracytoplasmic sperm, okay, it is what, intrauterine insemination. Alright, dear friends, so IUI, here what we are going to do is that, the sperms are, which are concentrated or placed directly into the uterus, my dear friends, when at the time of ovary releasing the egg. Alright, that's what we call intrauterine insemination. Then, dear friends, ISCSI, intracytoplasmic sperm injection, where sperm is injected into cytoplasm of the egg. Alright, so anyway, my dear friends, so here the woman who cannot produce ovum but can provide suitable environment, the best option we can go is assisted reproductive technique. We can go for in this option is B. Alright, next we have, which of the following is wrongly matched? Intrauterine insemination, alright, semen collected from husband or donor is artificially introduced either into the vagina or uterus. Alright, that's absolutely correct. Insemination itself means what? Introduction of semen, alright, in either by husband or donor into the vagina or into the uterus. That's correct statement. Option 2 is gift. Gamete intrafallopian transfer, the that stands for, the expansion stands for, but here it is given as what? Transfer of embryos, my dear friends. It is not transfer of embryos with more than 8 blastomeres into fallopian tube. Rather, it is transfer of the gametes into the fallopian tube, right, friends? So we need to identify the wrong here, wrongly matched one statement here. So option B is here correct answer. But anyway, we'll see the third as well. ICS, intracytoplasmic sperm injection, sperm directly injected into the ovum. That's absolutely correct statement. And in ZIFT, zygote intrafallopian transfer, right, transfer of embryos, all right, of 8 to 8 blastomeres into the fallopian tube. Yes, that can be possible, all right. So anyway, so the more here completely mismatched is here, what I can say, that is B option. So please go for it. So thank you for your patient hearing. Please be updated about the upcoming classes. Thank you very much.